Hello friends. So today we start with a important topic, miasm. The most controversial topic and so called very important. Right from the beginning of Hahnemann's time and today's era, this miasm topic, doctors have given various views on it. So in today's lecture, we will be seeing the development of miasm, what exactly the word miasm and the practical aspect of the miasm. My understanding begins almost 15 years back when I came across my mentor, Dr. Vijayakar. He was the one who introduced this topic to me. And really, in a real sense, I understood the meaning and understanding of miasm. Without that, really, the practice would have not reached to this extent. And it's so important, even Hahnemann, you know all, 20 years after the law of similars, he came to know that why he is failing to treat the case. And that's how the origin of miasm began. And he gave a view that without understanding the miasm, things can't happen anything. So today let's see what we'll be sharing with you, the development of the miasm, the various views put forward by the various doctors, the stalwarts, right from the beginning of Hahnemann's era till present. The new miasms, the most controversial miasm, but my dear friends, how important they are and how everyone has contributed to this homeopathic development in understanding of the miasm. So my dear friends, I will share with you an interesting case that was the first case where I realized and understood transformation of a genetic switch. It's constitutional switch. I say it's a transferring or transformation of the constitutional switch. The boy who came was just lean, thin, weak, and we see in every second, third year his face changed. And that was a real click for me and gave an understanding that we have to know the miasm to find the constitution. So here we will be discussing a case. I'll share with you a case and we'll see his journey in just across 6 to 7 years, what happened to his life. So you saw, dear friends, how we saw this case. Did you see the changes in his face, the looks, the face, his whole disease process changed after the right constitutional remedy. And my dear friend, today we will be discussing reversing the disease process and throwing the constitutional switch. This is a topic which we will be discussing. So we see here a different cases, a switching of the miasm. Let's see here. This case is a Jayesh Garg. See his face, Sora, psychotic, syphilitic. How his face transformed in few years' time from Sora, psychotic and syphilitic. This is the different case of an HIV. We will be discussing many of the cases in this whole course of time. A boy with HIV and nephrotic syndrome, almost at a deathbed, and he was told to go home and die. Completely syphilitic picture, and there was a transformation from syphilitic psychotic to Sora. Other case is Sadhna Gaikar. See the case, she had rheumatoid arthritis, autoimmune disorder, where there is complete destruction and it's an autoimmune disorder, and see the transformation in her. This is other case, Meghna, where we see the leukoderma, see the face, how she was and what happened to her. This is a very interesting case and the most learning case of mine, where I will be sharing this case with you in a psychiatric disorder. A boy, a drug addict, unfeeling, hard-hearted, and he was completely schizophrenic, and here he changed from this process till now. Can you see the face? Could you believe that this man is the same what he came to me just 1 year back, and that was a transformation in him. See this boy, his hairs, they are so strong. As I tell you, the miasms are nothing but it reflects what you think, what you are. Your thinking, willing and doing shows your face, your disease and whatever the things happen to your life. So this boy, as he was very hard-hearted, no emotions, no feelings, and then his hair also were standing. So your thought process gives you face and your looks. As his emotions became normal, his face changed and you see the hairs are becoming soft, and before they were dog-like, thorny like, strong, standing. See, the mother is showing the hairs. See this woman, how syphilitic her face is and changing to the sura. This case also will be discussing of chronic rheumatoid arthritis case. See the ptosis. Ptosis is nothing but, complete psychosis, it's less of an elastin. And there, after a right constitutional remedy, this man, in almost 20 to 30 days, his ptosis went away. It's a really miracle. With few doses, this change was there for him. This case also will be discussing in the course time. Rheumatoid arthritis was case treated by many homeopaths for almost 6 years, and within 6 months she came walking to the clinic. I'll be showing this case to you. In fact, after the right constitutional remedy, the deformity which she had also subsided. This is a case of a boy. Can you see this boy who is just 22 years old boy, and he has lost interest in his life, and you know what is the complaint? Completely azoospermia. The sperm count are very, very few. It's not it's an oligospermia. This boy, it's a real miracle case which I'll be sharing with you. Almost in 8 months' time, there was a great change in his sperm count. And he has a boy now who is 8 years old, and really this is a miracle of homeopathy, which only after understanding of the miasm I could do this result. So this case is of Razia Sheikh, tubercular meningitis, where she was hospitalized, and this was she was on anticox third time almost, because initially 2 times she had stopped the treatment, and now she was resistant to the tuberculosis. I'll be sharing with you. She was directly brought from the hospital to my clinic without the knowledge of an allopathic physician, and 1 dose and there was a transformation. See the change in her. Only homeopathy could survive her, otherwise you know what is the consequence of tuberculosis. This case is very interesting, which I'll be sharing with you. A case of an autism, very difficult to treat anywhere else. This boy, with the right constitutional remedy, started speaking in just 3 months of time. It was real learning, and I really feel blessed to know this healing science where we could do such miracles. This boy was a worst state. He was crying for almost 6 to 7 hours, was on a psychiatric drugs and was not speaking. And the remedy changed him. You see, my dear friend, journey with me is almost now 10 to 12 years, and this boy is going to the normal school with my medicine. Can you see this boy? See the transformation in him, what he had come. He was just 4 years, and now he is just 15 years old boy, handsome boy, going to the normal school. This is the miracle which was done with the right constitutional remedy. And my dear friend, it's only and only because of miasm. Understanding the miasm and just taking it into practical way, from there we can give one right constitutional remedy, and that's how we can see the miracles. See this girl, Yuganti. She was in cerebral palsy. The way she had come with all these cases I'll be sharing with you on a developmental disorder course, where next course will be developmental disorder. See the plight on her face, how she was crying, weak, not able to live life, and see the changes in her, the smiling girl. This is very interesting case where I'll be sharing a mental retarded boy. What is the hope for the mental retarded children in our society? Can they be normal? Never. Can you see this boy? Can anyone believe the face, what has changed, and the intellect? we have the power to bring up the intellect of a person. And it's the only science on the earth which can stimulate a genetics and bring the will, morals and intellect in a patient. And this is a healing art which we are doing. Can anyone believe that we can treat a hydrocephalus patients? The girl, you see the head, she was directly brought from the hospital. Almost 3 months she was in hospital and they were told her to put a shunt. The girl was such a critical condition that the shunt could not be done because her whole state was wrong. She was told to go home and let's see what is a fate for her. And here, at the month of her 7th, she was just 7 months, she came to my clinic. And I still remember the time where I was thinking twice that how I'll be able to heal this girl, a 7-month just girl with such a big head. My dear friends, really we should bow to Hanuman who has given such a science, and then I could take a challenge to treat this case and see the miracle. She's going to school now, who is 7 years old, and see the change in her. Can you see the transformation? What she's doing this, yes, this is a victory. You see her? A complete transformation, her looks, her face, her hair, her understanding, and without a shunt, she is a normal child. So this is the miracle. This is a very interesting case Fatima will be discussing here. This girl came just far away from Mumbai, almost 700 kilometers away from Mumbai. She came to my clinic where acute gangrene. She was told to cut away her thumb. It completely black. You see her finger completely black, and there was a gangrene. No doctor could treat her, and she was in actual pain. Her whole mental and physical turmoil she was in, and she was told that there's no remedy for her. You have to amputate your finger. And my dear friend, this case I'll be sharing with you. There was a complete transformation in her in almost 1.5 months. And still she's in touch with me on Skype. I'll be showing you videos on the Skype which I'm doing and treating her rightly, because she came all the way from far off from, and this is a change in her. See this girl. See how the emotional yo-yo can change your face and look, and see the transformation in this girl. See the smile. So many cases we'll be sharing in this video, and this is only possible with the miasm. Salivary gland was dysfunction because no salivation, facial paralysis, right-sided, very important. As I told you, right-sided affection shows the strength. You know, right-sided affection, they are strong, determined, positive, motive-based personality. So sinus problem, and there was no movement on the right side of the face, and there was a lot of weight loss. So what is the history of this boy? If you have to see, this boy was born and brought up in a village, had 2 brothers and 1 sister, had to struggle a lot in his childhood as house financial conditions were not good at home, and being an eldest among the siblings, he had to help the family economically. To help family financially and emotionally, he became very strong and took all the responsibility on his shoulder and took care of the whole house. This was an early responsibility for him at his age, and here this boy later on became so stronger with this responsibility that he even never bothered about his emotions or feelings. He devoted whole life to the welfare of the family and trying to help his siblings. Later on, he did hotel management after 12th standard. He used to work along with studies, and he had to look up for his family. He achieved everything what he desired for with his hard work and strength, because we know his face is very stronger, motive, right-sided, and he has a capability for that. What happened so that all the 4 friends were going to some picnic or some trip, and there he met a major accident and the life changed completely. What happened that when they were traveling, the car fell in a valley and everyone was badly injured. Almost 200 meters down, their car went away. all his friends got fractured, injured. He also fractured his face, body, almost a near fatal accident. And then in that bargain, he had destruction of his parotid gland. All the nearby people came to help them, and when this villagers came, this boy was put on a stretcher. Can you believe what is the first thing that boy told after he was put on stretcher? He said, "Where are my shoes? I bought it recently, new one, they are new." And all were surprised that this man is on a deathbed almost, with completely fractured, bleeding, completely right-sided broken, and he is talking what? Where are my shoes? And this was a clue for me to give a remedy. Because as I told you, important for us is to know every situation of a patient and how is his genetic nature. That is important to give a right constitutional remedy for him. Anyone would have given us just story, but I was understanding him, you know. And then, where is my shoes? I had bought just recently. And here we understand that how this boy was working hard towards the responsibility for the family. Every amount was important for him. And then he had struggled very hard to save such money to buy a shoes. And all the friends were shouting with pain, but this boy never complained of any pain, and the pain never affected him. He had no pain on his injured face, and in spite of so much affected, he stood up and started working again for this life. And this was enough for me for the case. My dear friend, this was only enough. As I took a case, they said, very responsible, very controlled, showing no emotions at all. So I am saying, always you have been strong personality. And he said, yes, I am always strong, responsible. And my sister is telling, he never shows emotions, he don't tell anything, we don't know anything about him. He is just working for the family. And even such a small, short case, and I saw the emaciation, he lost 15 kilos, the face was emaciated, and that was enough for me to prescribe in this case. We'll see the follow-up first. I think it's very, very interesting. We see the follow-up and then we come to the remedy, what I gave for him. We see the follow-up. The 15th May, we started medicine, and this is August 5th. May, June, July, August, 3 months. And the boy is on 5th August, he's come to the clinic. And what he's saying, I'm saying, what is the change in you? Let's hear what he says.
15th May, right?
Yeah.
We started our treatment. Come now. What is the change?
Now there is a movement in the cheeks.
From 16th May, we gave our first dose. After that, what has happened? First thing to happen, what was the first thing?
I am having the sinus problem over there. There was the shifting of sinus. Having cold.
You got cold after the medicine.
Yeah. Little bit, not that much. Because of that sinus, I had taken some medicines.
And you see, what happened of the medicine? He said the first thing, there was a movement on the cheek. What he was not able to, the whole right-sided with the facial paralysis, there was no movement, the salivary glands was destroyed, there was no salivation, he lost the weight, and he said the first thing to happen was a movement on the right side. Second thing, he said, I got very bad sinus. I said, what you did with the sinus? And he said, I took allopathic medicine for the cold. Good or bad? Absolutely bad. He suppressed his discharges, what was good for him. And here he's saying, I took allopathic drug for his cold. I was very, very annoyed with this.
Antibiotic?
Yeah.
You took antibiotic after my medicine?
Yeah, you had told me to stop it and you repeated the dose.
Right.
After that, I went to my college and over there the movement is gone.
Means what was the first problem? Your parotid glands are not functional.
Parotid gland, there is no movement on the right side.
There was no movement first.
No.
Okay, and there was no salivation also, no?
Yeah. Parotid gland is totally not working.
Now what has happened now?
Now there is parotid gland also working and there is movement in the cheeks.
Acha.
So can you see, dear my friend, what is the change in him? What is the transformation? The first thing, he started having a movement in his cheekbones and the paralysis has gone. The salivation has also started. A right constitution can give a miracle result in a case. You see here how he was being treated by the homeopath for 2 years and what is the change within a one dose of the medicine.
Not in the eyebrows, but and
Cheek
then,
movement has started.
yeah,
Okay.
means I can move now.
Show how? Before it starts not moving.
Like see,
Huh.
but
This side?
it is not working.
Do this side. This side is not moving. This side, upper portion is not moving.
No.
Okay.
At that time, there is no movement on the whole side of this right.
Now it has started.
Yeah.
Acha, but you could not eat the food, right? There was no salivation.
Yeah.
Now the appetite is good.
Yeah.
Salivation has come up.
My weight is increased by 10 kg.
10 kilo?
Yeah.
But after my medicine?
Yeah.
So from 2005, almost 5 years, 6 years, in 2012, he came to me. This 2012 or 13, he came to my clinic. You see? And see his look. He has built his body, how smart he is looking, and how everything is fine. Just look at him.
पण कसं वाटतंय आता जनरली म्हणजे तुझी हे कसं आहे म्हणजे
काही त्रास नाही.
काहीच त्रास नाही एकदम व्यवस्थित आहे तब्येत. आता तुला हे ऑपरेशन कम्प्लीट सगळं झालं
नाही काहीच नाही केलं त्याच्यामध्ये.
काहीच नाही केलं ना
काहीच नाही.
आणि वजन किती वाढलं तुझं
इथे तुम्हाला आठवत नाही.
एकदमच बारीक होता तो
73 पर्यंत मी नेलं होतं बॉडी बिल्डिंग चालू केलेली
आणि आता?
आता काहीतरी 68 काहीतरी आहे.
अच्छा अच्छा पण तुला आता सलायब्री ग्लँडचा प्रॉब्लेम होता ते कसं
नाही,
आहे
काहीच नाही तसा काहीच नाही.
बिलकुल सलायब्री ग्लँड आहे जेवता येते वगैरे एकदम सगळं
एकदम नॉर्मल.
भूक पण चांगली आहे उत्साह वगैरे वाढलाय
काहीच नाही issue.
And I had just, he said, I just came to meet you. I don't want medicine. I'm much better. He said, my weight has become 78. I was do bodybuilding. Now it is just come 65. I maintained it. There is no salivary problem. I'm eating. I'm very fine. My sister said, why don't you just meet doctor? Because I've started my business and hotel is flourishing well. So this boy has not come to take a medicine. Has just come to show me how changed he is after the right remedy after so many years.